If you are over 60 and you have noticed that stubborn belly fat that will not go away no matter what you do, doctors need you to hear something urgent. That fat around your midsection is not just sitting there. It is biologically active. It is producing inflammatory chemicals 24 hours a day. And according to leading medical researchers, it may be silently attacking your heart, your liver, your brain, and your pancreas right now while you read this. I know that might sound dramatic, but I promise you, the science behind this is real, and it is something that every senior over 60 needs to understand. Because belly fat after 60 is fundamentally different from the fat you may have carried when you were younger. It behaves differently. It produces different chemicals. It sits in a different location relative to your organs. And its health consequences are far more serious than most people realize. Here is what most seniors tell me. They say, Dr. Williams, I have tried everything. I have dieted, I have walked more, I have cut back on sweets, but this belly just will not budge. And they are frustrated. They feel like they are doing everything right and getting nowhere. But the reason their belly fat is not responding to the same approaches that worked when they were 40 is because the type of fat they are dealing with has changed. And until you understand that change, you are fighting the wrong battle with the wrong weapons. My name is Dr. Michael Williams, and today I am going to explain something that could fundamentally change how you think about your health. I am going to reveal what belly fat after 60 really is, why it is so much more dangerous than fat anywhere else on your body, and what doctors say actually works to reduce it. I am also going to expose the 3 things that millions of seniors do every day, thinking they are fighting belly fat, that are actually making it worse. And at the end of this video, I am going to share the one approach that researchers say is more effective at reducing dangerous belly fat than any diet pill, supplement, or crash diet ever created. So stay with me, because understanding this could add years to your life. Let us start by understanding what makes belly fat after 60 so different and so dangerous. There are 2 main types of fat in your body. The first is subcutaneous fat, which is the fat that sits just beneath your skin. When you pinch your arm or your thigh and feel a layer of softness, that is subcutaneous fat. This type of fat is relatively harmless. It stores energy, insulates your body, and cushions your organs. While nobody loves the way it looks, subcutaneous fat is not a major health threat. The second type is visceral fat, and this is the one that doctors are deeply concerned about. Visceral fat does not sit under your skin where you can pinch it. It is located deeper inside your abdomen, wrapped around and between your internal organs, including your liver, your pancreas, your intestines, and even your heart. You cannot see it or touch it directly, but you can identify its presence by the firm, round belly that many seniors develop, the kind that feels hard rather than soft when you press on it. And here's where things get alarming. Visceral fat is not just a storage depot, it is an endocrine organ. That means it actively produces and secretes hormones and inflammatory chemicals into your bloodstream. Among the most dangerous of these are cytokines, which are molecules that trigger chronic inflammation throughout your entire body. This inflammation is not the kind you can feel, like the swelling from a sprained ankle. It is a low-grade systemic inflammation that silently damages blood vessel walls, promotes insulin resistance, accelerates plaque buildup in arteries, and even crosses the blood-brain barrier to damage brain cells. Researchers have directly linked visceral fat to an increased risk of heart disease, type 2 diabetes, stroke, Alzheimer's disease, fatty liver disease, certain cancers, and even depression. In fact, studies have shown that a person of normal weight with high visceral fat can be at greater health risk than a person who is overweight, but carries their fat primarily in their hips and thighs. This is why BMI alone is such a poor indicator of health in seniors. It does not tell you where the fat is, and when it comes to health risk, where the fat is matters more than how much there is. Now, why does visceral fat tend to increase after 60, even in people who have not gained significant weight? The answer involves a perfect storm of hormonal changes, metabolic shifts, and lifestyle factors that all converge in the senior years. First, hormone levels change dramatically. In women, menopause causes a steep decline in estrogen, which played a protective role in directing fat storage to the hips and thighs rather than the abdomen. Without estrogen's influence, fat distribution shifts toward the belly. In men, testosterone levels decline gradually after 40, and lower testosterone is associated with increased visceral fat storage. Second, cortisol, the stress hormone, tends to be elevated in older adults due to chronic stress, poor sleep, and age-related changes in the adrenal system. Cortisol specifically promotes fat storage in the visceral compartment. Third, insulin sensitivity decreases with age, making it harder for your body to use glucose efficiently and easier for excess calories to be converted to visceral fat. And fourth, muscle mass naturally declines after 60, which reduces your basal metabolic rate, meaning you burn fewer calories at rest, and excess calories are more likely to be stored as visceral fat. This hormonal and metabolic environment is why many seniors find that the dietary and exercise strategies that worked when they were younger no longer produce the same results. Your body is playing by different rules now, and your approach needs to adapt accordingly. Now let me expose the 3 things that millions of seniors do every day, believing they are fighting belly fat that are actually making the problem worse. The first is crash dieting or severe calorie restriction. When you dramatically cut your caloric intake, your body interprets this as a famine. It responds by lowering your metabolic rate, increasing cortisol production, and breaking down muscle tissue for energy. Remember, muscle is metabolically active tissue that burns calories even at rest. Every pound of muscle you lose through crash dieting further reduces your metabolism, making it even easier to gain visceral fat in the future. This is why so many people who crash diet end up heavier than they started. They lose muscle, their metabolism drops, they regain the weight as fat, and the cycle repeats. For seniors who are already losing muscle through sarcopenia, crash dieting is particularly destructive. The second mistake is doing hundreds of abdominal exercises. Sit-ups, crunches, and ab workouts are among the most common exercises seniors try when they want to reduce their belly. But here is the reality. You cannot spot reduce fat. Doing AB exercises strengthens the muscles underneath the fat, but it does absolutely nothing to burn the visceral fat that sits around your organs. In fact, some seniors who do excessive AB work without addressing the underlying fat develop a stronger, thicker abdominal wall that can actually push the belly out further, making it look larger. Abdominal exercises have their place in a well-rounded fitness program, but they should not be your primary strategy for reducing belly fat. The third mistake is relying on fat-burning supplements and miracle pills. The dietary supplement industry generates billions of dollars every year by promising seniors that their products will melt belly fat, boost metabolism, and transform their bodies. The overwhelming majority of these products have no scientific evidence supporting their claims. Some contain stimulants that can raise blood pressure and heart rate, which is particularly dangerous for seniors. Others contain ingredients that can interact with prescription medications. Save your money. There is no pill that targets visceral fat. The approaches that actually work are not sold in bottles. So, what does actually work? Let me walk you through what the research says is most effective for reducing visceral fat after 60. The most powerful tool, according to researchers, is consistent moderate-intensity aerobic exercise. Walking briskly, cycling, swimming, or any activity that raises your heart rate to a moderate level and keeps it there for 30 to 45 minutes has been shown in numerous studies to preferentially reduce visceral fat. The key word is preferentially. Moderate aerobic exercise seems to target visceral fat more effectively than any other type of fat. Researchers believe this is because sustained moderate exercise optimizes the hormonal environment for visceral fat burning, increasing the release of fat from visceral stores while keeping cortisol at manageable levels. The ideal amount is 150 to 200 minutes per week, which works out to about 30 to 40 minutes most days. If you are not currently active, start with 10 to 15 minutes and gradually build up. The consistency matters more than the intensity. Walking briskly every day for 30 minutes is far more effective for visceral fat reduction than doing one intense workout per week. The second most effective approach is resistance training. Building and maintaining muscle mass increases your metabolic rate, improves insulin sensitivity, and shifts your hormonal environment away from fat storage and toward fat burning. Resistance training does not mean you need to lift heavy weights at a gym. Bodyweight exercises, resistance bands, light dumbbells, and even household items like water bottles can provide enough resistance to stimulate muscle growth in seniors. 2 to 3 resistance training sessions per week focusing on major muscle groups is sufficient to produce meaningful changes. The third approach is nutritional, and it involves reducing refined carbohydrates and added sugars while increasing protein intake. Refined carbs and sugar spike insulin, which is the primary hormone that promotes fat storage. Protein, on the other hand, supports muscle preservation, has a high thermic effect, meaning your body burns more calories digesting it, and promotes satiety, so you are less likely to overeat. Most experts recommend that seniors aim for 25 to 30 grams of protein per meal, distributed throughout the day from sources like eggs, fish, poultry, Greek yogurt, legumes, and nuts. The fourth approach addresses the stress and sleep factors that drive visceral fat accumulation. Chronic stress and poor sleep both elevate cortisol, which directly promotes visceral fat storage. Addressing these factors through better sleep hygiene, stress management practices, and relaxation techniques can create the hormonal conditions that allow visceral fat to be released and burned. This is often the missing piece for seniors who are exercising and eating well, but still struggling with belly fat. I want to close by addressing something that I think is really important. The goal of reducing visceral fat is not about looking a certain way. It is about protecting your organs, reducing inflammation, and extending the years you spend feeling good and living independently. Every pound of visceral fat you lose reduces the inflammatory load on your body, improves your insulin sensitivity, and takes pressure off your heart, liver, and brain. Let me recap what we covered today. Belly fat after 60 is primarily visceral fat, which is biologically active and produces inflammatory chemicals that damage your organs. The hormonal and metabolic changes that come with aging promote visceral fat storage. Crash dieting, AB exercises, and fat-burning supplements do not effectively reduce visceral fat and may make it worse. The most effective approaches are consistent moderate aerobic exercise, resistance training to build muscle, a protein-rich diet that is low in refined carbohydrates, and managing stress and sleep to control cortisol levels. These are not quick fixes. They are sustainable lifestyle changes that work with your body's biology rather than against it. And the benefits extend far beyond your waistline. They touch every aspect of your health. If this video changed how you think about belly fat, please subscribe to this channel. I share new content every week focused on helping seniors understand the science behind their health and make informed decisions. And if you know someone over 60 who has been struggling with stubborn belly fat, please share this video with them. Understanding what they are really dealing with is the first step toward doing something about it. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of yourselves.